Okay, we are now recording. Okay, today we're going to go over just a brief overview of the VMSG dashboard. Don't really need to take any notes for the first part of it. The second half, we're going to talk a little bit more about how to log in if you haven't already, how to change your password, and how to use what we call the quick update system, which is where most people do their updates on the system here. So let's go ahead and get rolling. We're going to go right on past our workforce development fellow here. Um, it's kind of funny back in the day, some of our folks in Florida nicknamed this presentation a drink from a fire hose. And what we've tried to do is cut it down a little bit more so we have kind of a drink from a garden hose. So not quite the fire hose, hopefully, and I won't drown you today. Um, Especially after the COVID issues that happened, we had a lot of turnover in health departments. And one of the things that happened is you brought a lot of new people in who weren't really familiar with all of the facets of public health. So, all the different things that you guys do are kind of floating around in the air. So, what we try to do is give you a tool to allow you to bring everything together in one system. And that's what the dashboard's all about. You can do anything that you're doing in public health in the system. You can plan for it, you can execute it, including things like grants and points of dispensing and all of your accreditation stuff, obviously. I believe I saw that you guys are heading for your second reaccreditation. Is that right? So you were accredited in 2023 and going on to great. We'll talk a little bit about the accreditation tools that are built in as well here. I'm hoping that by the time you get done with today and learning the system over the next couple trainings, you're a little bit more like this, a little bit laid back and understand that everything's in one place that you can get to and manage your business a little bit more efficiently. What is the VMSG dashboard? First of all, we are just public health. It was developed in public health specifically for public health. We're here in Arizona, and we worked with a couple of very large health departments here in Arizona to develop the system. And we were working with the health director, Dr. Bob England, who's just a great guy. What he wanted to be able to do is bring together all of the groups in his organization into one place, because when he was doing reviews of what's going on in the department, he would have to bring everybody into a big room and they'd be putting spreadsheets up on the wall and everything else. And it just didn't really work well. So he asked us if we could develop a system that would kind of bring it all together. So what we developed was this comprehensive operational planning and execution system. And one of the big issues with all plans, public health or any place else, is keeping plans up to date. You spend, huge amounts of money and time and effort to develop your strategic plan, which is typically a 5-year plan. And what happens is if you don't have a tool in place to keep it up to date, the plan sits on a shelf and collects dust for 5 years until it's time to do it again. That's what the Deming cycle is about. PDCA, plan, do, check, and adjust, is our nomenclature. And we'll talk a little bit more about that, how we keep everything up to date here. In 2011 came along, and we had developed a system before FAB was even a thing. Turns out that this is exactly what FAB was looking for. So they gave us the moniker fully demonstrated for performance management in the accreditation process. And one of the primary reasons is that we brought together everybody in the organization. So you've got everybody in your department plus any external partners in there. Now, when you get down into your reaccreditation process and you get down to FAB measure 9.1.6, it says provide 2 examples of staff at all levels, including leadership and management staff, engaged in developing or implementing the health department's performance management system. Well, I think you'll see in a few minutes here how through the real-time planning, we call it, which is the automated emails that you guys get, that engages everybody automatically. So we kind of get an automatic on 9.1.6. So what is performance management? We found out that when you went out and Googled performance management, most everything comes back as HR. This is not an HR system. So what we did is developed it specifically around the needs of you guys in public health. So it's really 3 phases. Phase 1 is operational planning. The plans that you see in the bubbles up here, what FAB calls their 6-pack of plans. So it's the minimum plans required for accreditation. And that's where most people start, but you can have plans for anything in the organization. You can manage all of your grants, manage critical documents, anything. And I'll show you a little bit about that as we go forth. So you can have a bunch of operational plans in a very specific planning model. Once you have those plans in place and you're executing them, we need to be able to monitor them. So we monitor them at multiple different levels. There's the big picture we call the macro level, the dashboard itself, and that gives you a view of any group in the system. The group can be a division, office, a program, or one of these primary plans we talk about. So you can have a group just for your strategic plan. So you can see a dashboard for the exact performance of your strategic plan, or the entire department, or community health division, anything in one group. Now, sometimes that is such a big picture that you don't see small things creeping up on you. And that's what the micro level is about. So down at the very bottom where we have objectives and activities in the pyramid that you see, that's the micro level. And you're monitoring things at that level so that you can catch them before they get to the macro level. And then VMSG Public is the ability to create public-facing web pages to share any information in the system with the public. And basically, it's just a real simple way to create a web page. Has a lot of graphical information on it versus, a lot of text stuff in there. And then performance improvement, that PDCA cycle we were talking about. So you develop your plans, you're monitoring the plans as you're executing them. The reason you're monitoring them is so you can check them. You're checking the plan versus the actual. If everything is on track, you keep going through the cycle. If not, you go to the adjust phase. And the adjust phase is that you're either going to adjust the plan itself, or you're going to adjust the resources to get to the plan. And I'll go into more detail on this in a minute. So the planning model here is very common. It's been around for many, many years. And it's a very structured operational planning model. And it looks like a pyramid, and I'll show you why here in a second. The top level is your organization. That's the health department. Typically, you'll see that there's a set of tabs across the top of the dashboard if you haven't been in there already. And the tabs from left to right is this pyramid going up and down. So the organization is your health department. Underneath that, we have what we call groups. Groups is a little bit nebulous because it's divisions, it's offices, it's programs, and it's the hierarchy of the department. So who reports to who, or not necessarily who as people, but which divisions report to different divisions and things along that line. In addition, the Fab six-pack of plans are independent groups because they're very high-level plans within themselves. Each group then has its own set of services or initiatives, services being ongoing things, initiatives being future things. Each service or initiative has a set of high-level goals. Each high-level goal has a set of SMART objectives. Each SMART objective has a set of activities. So what I'm going to do now is I'm going to take you live into the system, and we're going to walk through those three phases. We're going to develop a quick little operational plan. We use the example of tobacco cessation. We're going to take that plan through its life cycle so we can see the various tools to monitor it. And then we're going to take it through that PDCA cycle to see how we might make improvements. So we have a little demo organization we call USA Public Health, and I will take you over here. So when you log in, again, if you haven't already, you're going to see a screen similar to this. And depending on your login permissions as to how many of these menu items you'll see. But these are the tabs I was referring to across the top. So we take that pyramid and we flip it on its left side, and we've got the organization, groups, service initiatives, goals, objectives, and activities. So I'm going to go to our groups tab here. And again, the group is the hierarchy of the department. So group level 1, as you see, is always the department. Anything that's a level 2 is reporting to the level 1. So you see the Fab six-pack of plans down here is reporting to the department. Let's go down to Community Health Division. You'll see it's a level 2, so it's reporting to the department. And then under Community Health, we have Tobacco and WIC as level 3 groups reporting to level 2. Now, these can be rearranged, and we get into that in great detail when we go into the future trainings in here. But for instance, we have Tobacco and WIC reporting to Community Health because, the directors of Tobacco and WIC are probably reporting to the Community Health Director, so it makes sense. These levels can go from 1 to 10, and nobody's ever gotten past 5 or 6, to the best of my knowledge here. I'm going to go down to our Tobacco 2025 group. So now everything to the right in these tabs is within that group. So looking at the services and initiatives specifically for tobacco, we see we have 3 of them. Tobacco cessation, secondhand smoke, tobacco initiation prevention. Today, we're going to focus on tobacco cessation. So by selecting tobacco cessation, when I go to the goals tab, it's going to be the goals specifically for tobacco cessation. And you see we have 3 of those. Reduce smoking in high schools, reduce smoking in colleges, reduce smoking in public areas. Now, this is where we start setting the traffic light. The idea here is to have a simple visual indication of status. And there's actually 4 traffic lights. Green is go, everything's moving along as expected. Yellow is slow, something is slowing us down. Maybe something's going to be out on extended vacation or something and is involved in this program. Red would be something bad happened that brought us to a screeching halt. Maybe the person who's involved in a program left the organization and we don't have anybody to replace them. And then there's a gold bar. A gold bar indicates successful completion of that portion of the plan. Now, not everything gets to a gold bar. If I say we're going to reduce smoking in high schools, to me, successful completion would be zero. We're getting down to zero. Well, probably not going to ever get there. So it'll probably maintain a green status as we're moving forward in here. Now, underneath here, as we say, we reduce smoking in high schools, that makes sense to everybody. It knows what we're trying to do. What it doesn't tell you is which high schools we're going to start with. How much do you think we can reduce smoking? By when are we planning on doing this? That's what these SMART objectives are all about. And again, if you go Google SMART objectives, you'll get 100 different definitions. Ours is pretty simple: specific, measurable, attainable, realistic, and time-based. Now, if it's not attainable or not realistic, don't waste your time. Focus on specific, measurable, and time-based. So here's an example. We're going to reduce smoking at Wayne High School by 25% by the end of the school year. So specifically, we're reducing smoking at Wayne High School. Our measurement is by 25%, and by the end of the school year is our timeline. So it works out pretty well that way. To get us there, we're going to assign this person called an objective lead. Steve Hansen is our objective lead. If you need to change that, just hit the drop down and you get the whole list of people in the organization there. So Steve's our objective lead. He's got two jobs. Number one, to get us to this reduction here. So he's the project manager, program manager for the program here. The other one is to keep updated the current status. So down here, we're saying we're currently at a 25% reduction. The way Steve is typically going to do that is through, again, what we call real-time planning. Real-time planning is an automated email. Steve will get that email on a regular basis. You pick what it is. Most people pick monthly. So let's say on a monthly basis, Steve gets an email. In that email is a link that takes him right back into this objective so he can do the update on it. Now, anytime Steve does an update on anything in this objective, he might want to put a note over here. The note is just to tell them, that, hey, Steve did this at this point in time, or Steve put in this case, Fred Erickson put a note in there that we're at a 25% reduction. Now, you notice there's a date, time, and person stamp up here. That's optional. You can just type in a note if you want, or if you hit this little button up here, it puts in the date, the time, and the username in there. Now, the other thing we did recently, after you've been using the system for a long time, you can have lots of notes in here. There will be a little scroll bar that appears over here. You can scroll them forever, but if you got pages and pages of notes, it's difficult to look at. So one of our health departments, actually our folks down in San Antonio, Texas, asked us to put a kind of an expansion in there for the notes field. And that's what this is all about. If I click on that, it just makes a bigger notes field is all it is. It's exactly identical to the data down here. You got the time and date stamp up here. You got the save button down here, but it's exactly the same. Just gives you a bigger screen to work with in there is all. Now, the other thing you might say is, where am I going to get the information to update this particular objective? Let's say, for instance, for this one, we could go to the CDC smoking cessation fast facts webpage and get that information. So we put in there what we call a data source. And to get to that data source, I just click on the little link button over here. It should open a new browser tab for me and take me right to the CDC smoking cessation fast facts webpage. So we're assuming at this point in time that this is where the information for Wayne High School would be in there. Now, this can be anything you want it to be when you're setting this up, and we go into great detail on the operational planning training. But when you're setting this up, you can have anywhere on your intranet, your file servers, your internet, any place that you can put a link, you can put a link in there. So you always have exactly what you need when you need it in here. So this is my SMART objective. This is the target: reduce smoking at Wayne High School by 25% by the end of the school year. What this doesn't tell us at all is how are we going to do that? And that's what the activities are about. A lot of people call these action steps, which is a pretty good name for them. It's the steps we're going to go through that we believe will get us to that objective in here. Now, in the system, there's three distinct types of activities: project-based, quality assurance, quantitative measurement. When the system was originally designed some 15, 20 years ago, whatever it was, project-based was the only type of activity, and it covered most everything. But then we had requests to add the different types, so we added different types. I got an example of each of them. We'll kind of walk through it. So our first activity: create training content and materials for students and faculty on the dangers of smoking. So we're going to think about, making some PowerPoints, some user guides, some video content, whatever we can do. Every activity's got a performance metric. How do I know when I've successfully completed the activity? So once the training content has been completed, we're done with the activity. We've got a beginning and ending date down here. So this is when we planned on doing it. And as you can see, we marked ourselves as 100% complete. So this particular type of activity is 0 to 100%. It's a real simple measurement in here. And again, you see the date and timestamp notes down in here. The other thing we do is we add teams of people to do this. So who is actually going to be creating the training content? You can see we have 3 folks down here. To change that, I just click on this little button here. And right now we're filtered within the tobacco group. So I'm going to open it up to the whole department. So you see 3 columns, team members. So we got 3 team members who are creating training content. We got Diane designated as the lead and that email notification. So the same email that Steve got, Diane's going to get, except it's going to take her to her particular activity that she's done. Over here on the right, FTE, full-time equivalent, not used very often. If you're going after grant dollars, you need to know how many grant dollars do we need to fund this program. You can use this tool over here. So what you're going to do is put in this case, Diane is spending a 0.1 or 10% of her time on this particular activity. And then you got William at 10% and you got Andrea at 30%. So if I take and roll that up to the activity itself, it rolls up the 3 of those to a 0.5 FTE at the activity level. And if I take all 3 of these activities and roll them up to the objective, you'll see down here we have a 1.0 FTE. So what you'll do with that is you'll take that number and multiply it by what we call the average burden cost of labor. And that includes salaries, benefits, transportation, facilities, everything that it takes to have a person in there is what you're going to multiply that number by. So it gives you a fairly reasonable estimate of what the costs are, at least the human cost of doing that kind of stuff. And again, if you're doing your budgeting for next year, it's nice to be able to use that. If you're going after grant dollars, it's nice to be able to understand that. Down here at the bottom, we have the ability to add external partners. Again, click on here. I'm going to say that we have VMSG Dashboard as an external partner. And in this case, Fred Erickson at VMSG Dashboard is our partner. You can have as many partners as you want. You can assign as many as you want. You can have as many contacts per partner as you want. You can assign as many contacts as you want. So in this case, we're just saying Fred Erickson is the partner. Now, at this point in time, all it's doing is designating a partner. If you choose to, you can make this partner a system user, what we call a partner user, and then they can have access directly into the specific activities that they've been assigned to. So instead of you having to go contact Fred and say, hey, how you doing on building the video content or whatever, and then you going back and finding the activity and updating it, it can go directly to Fred. We'll train them on how to do it. They can go back in and do the updates. So it just saves you a lot of time and effort. So that's activity 1. That's our project-based activity. Activity 2, we call a quality assurance activity. The QA activity is just unique in 2 things. Number 1, it's repetitive. So what we're doing is we're setting a frequency, we call it. And the frequency in this case is set to monthly. You can set that anywhere between weekly and every 5 years. So it's going to repeat on a given basis. And the other thing this one does that's a little bit unique is that it automatically sets the traffic light based on the values you provide. So we're going to provide 9 training sessions each month on the dangers of smoking to students and faculty. So if we get to that 9 training sessions, it's going to set the light to green. If we only get to 6, we just pick that value randomly, by the way. If we just get to 6, it's going to be red, and 7 or 8 will be yellow. So it's always moving in a different frequency here, and it's going to automatically set the traffic lights. And as you decide to move this activity forward to the next month, it's going to ask you, do you want to reset this value to 0 and start over again, which you typically do. So that's our QA activity. And then the third one is what we call a quantitative measurement activity. The only real difference between this and a project-based activity is that we have a target quantity. So you think about all the different things that you would count in public health. How many car seats did we install this month? How many medications did we provide? How many vaccinations did we do? So lots of different things that you can count. So if you got a target number, say we want to do 20, contact all 20 tobacco vendors within a mile of Wayne High School. So if I know that our target is 20 and we've done 10 out of 20, it's going to calculate to be 50% done. If we did, in this case, 20 out of 20, it's going to calculate to be 100% done. So that's the primary difference. It's still got a beginning and ending date and all the people assigned to it and everything, but this time you have a target quantity in there. So these are the 3 activities that we believe are going to get us to this objective here. Now, if we go back and look at this in a pyramid, it looks like this. The group we selected was Tobacco 2025. The initiative we selected was tobacco cessation. Underneath that, we had a couple of goals. We selected reduce smoking in high schools. Underneath that, we had a couple of objectives. We reduce smoking at Wayne High School was our objective, and then the steps we're going to go through to get there. Now, the reason the pyramid model, think about this for a second. Your strategic plan is a group within itself. Typically, in the strategic plan, you're going to have somewhere between 3 and 7 strategic priorities, or what we would call services or initiatives. So let's say we have 4 of those. And let's say each of those 4 initiatives has 4 goals. And each of those 4 goals has 4 objectives. And each of those 4 objectives has 4 activities. If you do the math, that comes out, I think, to 256 activities. So the bottom of the pyramid gets really, really wide, and hence the reason the pyramid model kind of makes sense. So this is our plan. Now, let's take that plan through the PDCA cycle. So the plan is in place. Now we're going to take the plan and we're going to execute the plan. In this particular case, Diane and her team are going to finish up building the training content. And then William is going to take the training content and go out to the schools and provide the 9 training sessions a month. And Tom is going to go out and talk to those tobacco vendors to make sure they're not doing any bad things out there. And this is where that real-time planning comes in. So each of those folks is going to get an automated email. Again, you set it anywhere between daily and monthly. Most people set it for monthly cycle. So on a monthly cycle, they're going to get an email. The email has a link that takes them back to their designated activities and objectives so they can update them. And just to give you an idea, most people using this system, when you take it down to the person who's actually doing the activity level, not their supervisor, not anybody else, the person who's doing it, because they know the answer off the top of their head. What's going to happen is it's going to take them about 3 to 5 minutes per person per month to keep the system up to date. And it's critical that you have that real-time information if you're going to be managing your business around this. So the idea here is to get the emails to go to the people who are actually doing the activities or managing the objectives, and they can answer it right off the top of their head and get you moving forward. The reason we do that is so that we can do the check phase. The check phase is real simple. It's comparing plan to actual. So this is our objective here. This is what we're trying to accomplish. Our target is to get to a 25% reduction. This little chart button right here shows us the timeline. So from August 15th of 23, when we rolled out the program, we were at a 0% reduction. And then you can see we slowly creeped up and got to our 25% target. So at this point in time, we are at the target here. So by doing that, we're going to go into the adjust phase. And in this particular case, we don't need to make any adjustments. Our plan was 25, our actual is 25, we're right on track. So we're going to skip over the plan, continue to execute, check it every once in a while, continue through the cycle. Now let's say for a second that the top of that chart I just showed you, which by the way is what we call the micro level performance monitoring, the top of that chart was at 21% and not 25%. Now we got to make a decision. The decision kind of comes down to one of two things. Is the plan just too high and we can't get there? If that's the case, we adjust the plan maybe down to 21%, continue through the cycle. Or if we threw more resources at it, could we get to the plan? So maybe in this case, we need to do more training sessions. So instead of 9, we do, let's say, 12 training sessions. Maybe there's more tobacco vendors out there we didn't know about, so we're going to get to those guys. Maybe there's a couple other activities we hadn't thought about at this point in time to get there. So whatever we need to do to up the resources to get to the plan. And then there is kind of a fourth option, and that's kind of the in-between. And that is, let's say the plan is just a little bit too high. Maybe 23 is a more realistic number. And then to get to 23, the only thing we might have to do is to create more training sessions. So those are kind of the 4 options in here. But you're going to make the adjustments and continue through the cycle all the time. So all these plans are going to stay up to date based on collecting the information in the background, making the adjustments as necessary, and moving forward. So that's the PDCA. Next thing I want to talk about is that macro level we talked about. This is the dashboard. I'll take you back live again. So the dashboard is based on a specific group that's selected. I can have a dashboard for the entire department. I can have a dashboard for just my strategic plan. In this case, I'm going to come down here. Let's say I'm the community health director. When I log in, the system takes me right to my default group, which is community health. And as you remember, we had tobacco and WIC under community health. So I want to see the dashboard, which is community health plus tobacco plus WIC, because those folks report to me. So when I come in here, I'm going to be at community health. The only thing I need to do is click on this little traffic light up here in the top right corner. And what that's going to do is take about 10 or 12 seconds to go out and gather up all the data points in the background. And then it's going to give me a very finite focus on community health. Top left corner up here. This is the big picture. I'm looking at the activities, the objectives, or the goals for community health. You can see the numbers over here. We have 1 red and 3 yellow, 3 green, and 7 gold. By the way, you can see the little click finger, meaning I can drill down on anything on the screen, get to the data elements behind it. So if I want to find out what this red activity was, I just click on it. It takes me right there. The gauge here that you see is taking all of these, looks like 14 activities, and it's calculating together that they are 3 days ahead of schedule. Once you drop down below schedule, it turns yellow. 60 days below schedule, it turns red. So this is my first view here, is kind of the big picture. Ideally, you'd like to have everything green, gold, and then green up here, and you know that everything is working. Down here at the bottom, we got a couple of drill downs. Number 1 is our people. So these are the folks we assigned as the activity leads. This is the last time they updated their information, and the color coding is pretty simple. Green is less than 30 days, yellow is 30 to 60, and red is over 60 days. Ideally, you'd like everybody to be in the green, maybe a couple of yellows, people have been on vacation or whatever. But the red, you need to have a chat with Tom and find out, why he's not getting that up to date. Here's that FTE number rolled up by person. When you're assigning FTE values at the activity level, you don't want to go over a 1.0 FTE. Once you get to something like a 1.55, you're way overloading Diane, and it's going to cause problems. Lagging just indicates that we have activities calculated to be behind schedule. The days is the same as this schedule gauge up here, but just for Diane. So overall says she's 62 days ahead of schedule for all of the activities she's been assigned. She has nothing overdue. Overdue would say that the ending date of the activity is before today and it's not yet 100% complete. And then the number of red, yellow, green, and gold. So that's view number 1. There's 2 other views in here, and we'll get into detail in the performance monitoring training. But groups, basically this first column would be community health, tobacco, and WIC, and then the same information over here. And then my third one is priorities. That is the strategic priorities from your strategic plan down this column, mapped against everything else in the system. And we do that through what we call 3-dimensional planning, which is another training session. But it gives you the how does everything, in fact, roll up to our strategic plan, and how does our strategic plan affect everything else in the department. Top right corner, my priorities. Individually selectable objectives. So these are the targets that you want to keep your eye on. Usually they're things that are yellow and red because they need help. And typically they're things either you're working on or your team's working on. There's a little flag on the objective screen you set, and then next time you go to the screen, they show up there. It's the ones that you select that you want to keep your eye on. Everybody selects their own. You don't select them for anybody else. So that's our dashboard. This is the macro level. And VMSG Mobile is the ability to see some of these things on your phone. So this is the same dashboard screen you just saw broken down into 3 phone screens. Now, you don't need an app. It's what I call a dynamic app, meaning it's built in the web browser on your phone. So you go to the web browser, you go to the same link you would on your desktop, same login credentials you do on your desktop, and it brings up VMSG Mobile because it knows you're on a phone. Top left corner, bottom, top right, exactly the same. Everything's clickable. I can drill down. I can, add my priorities. Everything I can do on the desktop, I can do on my phone. So if you're one of those folks who's out and about in the community, you've got this available to you. Accreditation. I know you guys are heading for your second round of reaccreditation. We have every accreditation plan known to man built into the system, and they're all available to you. You can have as many as you want. Let me walk you through that real quickly here. So I'm going to go down here. So you guys would be going through FAB Reaccreditation 2022 Local. So the current version of FAB Reaccreditation. You see we have the accreditation plans, the pathways plans, everything else is in here. Let's go down to this one and take a look at it. As I start drilling down the plan, first thing we have is the accreditation process, which doesn't mean a whole lot in reaccreditation because it really the first 5 steps are accreditation, and then you got your annual reporting and reaccreditation. So not a lot in there. However, as you get down to like the domains, under the domains are the standards. Now, one of the other things we did, these plans were all designed and built from the FAB documentation, but we couldn't put obviously all of the documentation in there. So what we did is gave you a link down here to the specific document for, in this case, reaccreditation. And if I click on the link here, it's going to take me right to the FAB document for reaccreditation for standard 1.1. There it is right here. Now, the nice thing about this is if you notice there's 237 pages in this document, it takes you to exactly where you need to go without having to cycle through the table of contents or any of that kind of stuff. So just a nice convenience feature in there. Now, when you get under the standards, you got the measures. This is where documentation comes about. This is where Fab wants you to, put your documents in for the measures here. So this is document management. And you'll see this little blue button on every screen. It's kind of subtle, but you can attach documents anywhere. So it says right now we have 3 documents attached, and the measure is develop a community health assessment. The document requirement is 1 community health assessment dated within 5 years. So I'm just going to go ahead and attach the community health assessment here. You notice it shows just one. It said we had 3, and it shows just version 3. If I want to see all 3 versions, I just click up here, and there we go. So yellow typically is a draft. Green would be we as the department have finalized it, and then gold would mean we have submitted it up into the EFAB system. So you can easily track the documents this way as you're going through. And there's a way to look at all the documents in the accreditation plan, and we'll go into that in future training as well here. But basically what you're doing is keeping a version of the document in here, and you're marking it with a traffic light so you know exactly where it was. Now, believe it or not, not everybody in the world knows what's in a community health assessment. So what we did is took it down to the next level, which is what are FAB's requirements for a community health assessment? And you see there's 7 of them in here. So this is a good place to start typically, is starting down here at the community health assessment activities. So it says you got to have a list of participating partners. And again, you notice the document management's got 3 documents. It's those lists of partners in there. So what you'll typically do is you'll go through all of these activities, get all the documentation together for that, and then take that information to build your community health assessment. So it's all built in there for you. Now, I don't know if we've done this at all with you guys or not, but basically what we do to get you started is we're going to go in there and you're going to tell us who are your domain leads. So who are the people, and it's a person basically that you've assigned as the primary domain lead. We push that name all the way down to the objectives and the activities. Then the other thing we'll do is at the activity level, you're going to tell us when you're planning, and you guys are a couple years out still. So when you're planning on submitting final documentation, and we typically back it up about a month, so you got a little leeway in there. And we'll put that end date in there, put your beginning date as today or whatever you want it to be. And by doing that, by putting the people in there and the dates in there and turning on the real-time planning, the system kind of takes over the process, automates the process by attaching or going out to everybody who's designated as an objective or an activity lead, saying, hey, it's time to update your CHA or whatever it happens to be in there. So it's going to help you to manage the process all the way through. And if you're keeping everything in here, you've got the perfect performance management system for standard 9 for FAB out there. So that is the plan, the accreditation plan. And like I say, you can have all of them that you want. I don't know if you guys want any of the previous ones like the FAB 2022 local, but this one is probably the one that you'd want to start with here. Now, as COVID came about, we had a lot of health departments who were still going through the accreditation process. Sounds like you guys were doing that as well. One of the things a lot of people do is what I call a mock site visit, where they hire some expert consultant to come in and review everything they've done before they go into the FAB process itself. So, during COVID, people weren't traveling much. A lot of health departments are working from home. So it made it very difficult to have a person come in and do a mock site visit. So what we did is we put it online. What you'll do is you'll pick the person, and we got some folks we can recommend for you. You'll pick the person. We'll give them access to your accreditation plan. We'll train them on how to do it. The folks we've worked with have already been trained, but you can hire anybody you want in there. And then they'll come in and go through every activity, and they will review the activity. You can put in notes, put in traffic lights, all kinds of stuff. At the end of that, there's a report that gets generated that shows your stuff and their comments and notes and traffic lights. You compare the two, you say, yep, we're ready to go, or we need to make a couple updates before we go. So it's just a real simple way to do a mock site visit. And by the way, it saves you a lot of time and money as well. So what we just talked about is what we consider to be the core functionality of the VMSG dashboard. Most people who are going through accreditation or reaccreditation start out by getting their FAB 6-packet plans in there. Most people start with a strategic plan or the chip, but you can start anywhere you want. Get those in there. If you need any help, we get you going as well. You're going to turn on the real-time planning. So you're going to have the email notifications going out. You're going to use the accreditation plan to manage the process and be able to track it at all times. Everybody who's done those three things has gotten fully demonstrated by FAB for performance management. So we know that it works. We've been doing it for a long time. Now, I'm going to walk you through a couple of different things. I want to go into real-time planning a little bit more detailed, show you a couple of the other features that have been added to the system, and not in great detail at this point in time. I'm going to walk through the login process, how you do that, how you change your password, and then we're going to talk a little bit about quick update, how you can do the simple updates on stuff. So let's go back and talk about intelligent document management first. Over the years, we've had document management since day one, specifically for accreditation. But we've had a lot of people who've come to us and said, "Hey, we can do more with this. We have the ability to effectively manage policies, standard operating procedures, memos of understanding, grant documents, FAB documents, any kind of documents in there." Let me show you an example here. Go back to my groups tab. I'm going to go up to what we call critical documents. So we created a group called critical documents. As I drill down here, we have the types of documents. So policies, SOPs, MOUs, grant documents. You can have as many as you want. Under policies, we might have manage and update administrative policies, manage and update healthcare policies, and again, as many as you want down there. You get down to the objectives. Update department administrative policies each fiscal year. Okay, so this has to be updated every fiscal year. At the objective level, we have a policy called the 24/7 coverage policy. We made a modification to the QA activity called a timeline. And what it does is we're going to set it for an annual cycle. The beginning date is the beginning of the fiscal year. So what's going to happen as you progress through the year, it's going to determine when you get to some position that you set. 90% is a good number to use. That's about 10 and a half months through the year. So about mid-May, this light will turn yellow. When this light turns yellow, Andrea is going to get an email, that real-time planning email from the system. It's going to have a link right back into this activity. She's going to go into document management. She's going to download the current document, do the updates on the document for the next fiscal year, upload the new version, does automatic version control. She'll hit the save button. It'll say, do you want to move the date ahead to the next fiscal year? She'll say yes. It'll move this to 7/1 of 26, and it's all set to go. So it just automates the process of managing critical documents, any kind of documents, any place in there. Reporting, there's a boatload of reports in there. The reports now include AI. Let me show you what that looks like. And I don't know if we've turned it on for you guys or not. We put out an email to everybody, and some health departments don't like that. Some do. And if you want it, we can turn it on. We can turn it right back off just as easily. But let's look at the tobacco program here. And let's say I wanted to do an operational plan report for the tobacco program. I'm going to click on my reports management button here. I'm going to click operational plan. Now, this is the AI summary. Here's what's happening. It's going to say, how many words do you want, basically? Anywhere between 10 and 500. I'll just say 200. Do I want just a summary paragraph? And it's just a summary of the plan. Do I want to include it in the top of the header of the plan? Or no thanks, just gives me the plan. I'm going to go ahead and say include. Now, this uses Grok as its AI engine out there. So what's happening is it generates the entire operational plan report for the tobacco program. Then it takes that report, sends it up to Grok. Grok summarizes it into a paragraph, as many words as you want in there, and then it presents the report with the paragraph in it. And depending on how fast Grok is during the day, sometimes it takes a little while to run the report here. But here it is, pretty good. Okay, so the top of the report is vision, mission, and values. This is the summary paragraph that Grok just generated. So this is the operational plan report for tobacco programs 25 under USA Public Health Initiative, envisions healthy and safe community. It does a beautiful job of summarizing the report. So everything you have down in the operational plan report gets summarized into that paragraph. And again, it can be anywhere between 10 and 500 characters. I don't know if we've turned this on for you guys or not. If not, happy to turn it on so you can play with it. If you're higher up, say you don't want AI in there, that's fine. But just as an FYI, nothing in the AI world is getting back into the system. Like I say, it generates this report, then it sends the report up to Grok. Grok comes back with the paragraph, and then we just generate the report again. So it's not getting into the system, so it can't get in and affect anything or grab any of your data in the system. VMSG Public is, again, a way to create public-facing web pages. It also includes that same AI feature, so you can have a a graphical page that has a timeline and that sort of thing on it, just a chart. And then it can have the AI summary paragraph in there as well. And again, we go into all this in detail in future training. And then three-dimensional planning is just a way to interconnect everything on the system. So how does my strategic plan connect everything else? And you can connect anything together. Again, there's a separate training on that. Now, what I'm going to go into now is a couple of things that are kind of critical for everybody, and that is the real-time planning. So the real-time planning, again, is that automated email, and here's how it works. You're going to set it for something between daily and monthly, and I do not recommend daily because people will come into your office and start burning your furniture and that sort of thing, so you don't want that. Monthly is a pretty good cycle here. So let's say we set it for the first Monday of the month. So the first Monday of the month at 1 a.m. California time, the system goes in and looks at everybody designated as an objective lead or an activity lead, and it asks 3 questions about that person. Number 1, has this person been in the last 30 days and updated their stuff? Number 2, does this person have anything that is behind schedule? And number 3, does this person have anything that's overdue, past the ending date, not yet complete? If none of those are true, no emails go out, no spam. If any of them are true, out go the emails. As we mentioned, the emails can go to internal folks as well as external partners. Now, the only people who get those emails are those folks designated as objective or activity leads. So when they log in, they're going to get the opportunity to go into what we call quick update. And I'm going to take you live into this in a second. Quick update is just 2 screens, one for activities, one for objectives. There's the top of the pyramid is up here. So group, service, goal, objective, activity 1 of 29 or whatever it says there. But there's only 3 fields you're going to update. You're going to change the traffic light if you need to, just by cycling through it with your mouse. Change the data value down here. So I did 9 training sessions this month. I can put a note in here. I can time and date stamp the note. I've got my data source down here. Hit the next button to cycle through my activities. When you get done with my activities, if I'm assigned to an objective, it's going to give me that. I'm going to get through those. And again, typically 3 to 5 minutes and you're done for the month. This is what the email is going to look like when you get it, if you guys haven't seen them already. These are those 3 criteria I mentioned. Why did I get this email? This is kind of a summary of the status of the activities I've been assigned. So my green, yellows, red. Your admin users will show up on here. So you're going to have the name, email address, phone number in case you have any questions. And then the link. This is the link that takes you right back into the login. So I'm going to walk you through the login 2 different ways. Number 1, just going to go through a bullet list of what to do, and then I'm going to take you live and show it to you. And by the way, in the meeting invitation that you got, there's a PDF document that walks you through logging in and changing your password. So it's in there as well. Let's go through that. You're going to go to this link, login.vmsgdashboard.com. You're going to get a little dialog box with a 3rd button called send, which means send me my login credentials. You're going to click on that. It's going to ask you to enter your email address and then click send again. Hopefully you'll get a success dialog, meaning your stuff is in there and it just sent you an email. And by the way, the email goes out immediately. So if you don't get it in a minute or 2, check your spam folder. If you don't get a success dialog, if you get a warning or an error or anything else, please contact us. We'll get you fixed up. Then you're going to click the login button in the middle of the screen. It's going to take you back to that same dialog that you got first. This time you're going to enter either your user ID, the new user ID you got in the email, or just use your email address as your user ID. It takes either one. You can go back and forth, whatever you want to do with it. Then you're going to enter your password and click login, and you're all set to go. So that's the process here. Now, the email that you get back is real simple. It looks like this: user ID and password. And again, if your user ID is typically your first name dot last name. If you don't want to remember that, just use your email address as your user ID. I do recommend, however, that you copy that password. The password is system generated initially, and it's got some cryptic characters in it sometimes that are hard to read. So if you just highlight and copy the password off this email, you'll have it for when you're logging in. So let's go ahead and go through the login process live here. This is the log off button, the red button in the top right corner. Go ahead and see, yep, I want to log off. It's going to take you back to the VMSG homepage here. Up here, already a VMSG user, log in here. Let's click on that. First thing it's going to do is take us to that dialog with the send button. So I'm going to go ahead and say send. It's going to ask me to enter my email address. I'll put that in there. Hit send again. Hopefully get the success dialog. Success, we found all your stuff, we sent it to you. Hit OK. Next thing I'm going to do is hit my login button up here. This time I can put in my username or email address, and then this is where you're going to paste that password. Click on here and hit Control V on your keyboard, paste, and it'll paste that password in there, and then go ahead and click login. Now, if you've been designated as an activity or an objective lead, you're going to get this dialog. Do you want to go to the main menu, which is where we've been all day, or do you want to go to quick update? Quick update is those two screens to do the update. So we'll choose that for now. It's going to take us to the activity quick update screen, and just specifically for the activities I've been assigned. So here's the top of the pyramid, as you can see, activity 1 of 3. So I've been assigned 3 activities. Again, down here at the bottom, I can cycle through my traffic lights. I can update the value here. I can put a time and date stamp note in here, or just type a note in there if I wanted to. If my data source is available, it will be down here with the button, and then my next button. I've also got, as you can see, document management up here. So if there's documents attached to this particular place, I can get those documents, I can update them, I can add new ones, I can delete them, whatever I need to do. I'm going to go to my next activity here. So I'm now activity 2 of 3, activity 3 of 3, and so I'm done with my activities. It says, hey, you're also an objective lead. Let's go to objectives. So we're going to see a similar screen for objectives. The objective is above the activity, so it's up here on the screen a little bit. Again, traffic light, data value, notes field. It says I got 1 objective. The other nice thing about it is the activities for that objective are shown up down here. Now you notice that the bottom one is in blue and the other 2 in gray. The blue indicates that this is also assigned to you, meaning that you just went through it, so you don't have to worry about it. The 2 that are in gray means that you have probably assigned them to somebody else. But let's say that person's on vacation, you want to update them. You can click on them and update them and get that done as well here. And then I'm going to click the next button, and it's going to say, hey, do you want to log out? In this case, the next thing you might do is log out. Let's go back to the main menu, which is this gray button up here. Now, the next thing I want to talk about is, first of all, VMSG Mobile Quick Update. Same thing on your phone. So you're out and about. Let's say you're coming in on that first Monday of the month when the email went out. Decide to stop at Starbucks for a coffee on your way into the office. Grab your coffee, sit at the table, pop open your phone. Here's the email from VMSG. Let's go ahead and get this done. It'll only take 5 minutes here. So I'm going to pop that open. Again, same login link, same login credentials. You're going to go into there. You got an activity screen, a little bit smaller than on the desktop just due to real estate. But again, notes, traffic light, data value, next, objectives, notes, traffic light, data value, next, and then you log out and you're done in 5 minutes. So it's just a nice convenient feature to have in there. Now, back to here. The next thing I want to show you is no matter where you are, let's say I'm at my service initiative screen here, and I have a question about what are these buttons for? How do I add one? How do I remove one? Everything is available under the blue eye, help and information. And it's context sensitive, so it took me right to where I was, adding managing services initiatives. It's got a step-by-step process up here to do anything on that screen, plus a full definition of every button on that screen, not just a little rollover, but a full definition on how to use that button in there. In addition, down here, there is a video training module on each section. So this is about 5 minutes on all the stuff that you can do on the screen, basically, but service initiatives. This is the entire user guide on one hyperlinked PDF file. So the table of contents has got links in it you can click on. This is implementation guidelines, stuff we've been collecting over the years from different clients about what works best, what doesn't work so best. Here's some issues we ran into. Here's how we solved them. Here's the type of people that work best in a system like this. Here's the type of people who don't care for something like this. There's some templates in there, just all kinds of good stuff. It's worth a read if you're going through it in here. So this is available to you 24/7. In addition, all of the training that we do is available in video-based training right here. So these top 5. We're doing the intro today, so you can skip over that. If you don't have time to, join us online here, we prefer to do it online, but there's a training video for basics, for operational plan development, performance monitoring, and if you're an admin, you'll get the admin training as well. Total, after today is about 2.5 hours worth of training or something like that. But again, we prefer that you join us online so you can ask questions and that sort of thing. So all that is available to you here. And that was your drink out of a fire hose / garden hose for the day. Questions? What else can I show you? Did you all drown? Is that it? Got your snorkels and masks on? Okay, well, if there's no questions, we have another session with another group of people here starting in about an hour. But if you do have any questions, here's my contact information. Please feel free to reach out to me. I'm happy to help any way that you need. Okay, everybody, thank you so much.
Thank you, Fred. Thank you so much.